everyone, this is Dr. Kanita here to show you hyperbaric oxygen therapy chamber, or HBOT for short is what I call it. So hyperbaric oxygen therapy is basically adding oxygen under pressure into the system. So how it kind of works is right now in the atmosphere, we're breathing around 21% of oxygen, right? So when we breathe that in, our red blood cells get that oxygen and transfers it to all the cells in our body, right? So in this case, in the hyperbaric chamber, what happens is you breathe in around 100% oxygen, was like 90% oxygen, but the difference is we're going under pressure. So right now, to keep it simple, in this environment, we're about 1 atmospheric pressure, but here when you go under the chamber, it's 1.3 atmospheric pressure. And so what happens is when you add that pressure in conjunction with breathing in more oxygen, you're actually perfusing the plasma with a higher concentration of oxygen, and you can't really do that under any other circumstance. Even if we breathe 100% oxygen, you still get a benefit, but without that pressure, you're not adding in more oxygen into the plasma or the tissues. So when you're adding the pressure in conjunction with breathing in more oxygen, a higher concentration of oxygen, you're actually adding a whole bunch of oxygen into your plasma, into the tissues that may in certain areas that you could not get the oxygen there. So like, why would we need oxygen, right? We need oxygen to breathe, but what's kind of the other mechanisms that oxygen works? So what's called the powerhouse of our cell, the mitochondria, right? That's the part of the cell that have energy, right? To exercise, to run, to think, to work. Like, we need our mitochondria to work, or else we basically couldn't do anything. So in the mitochondria, we have this amazing thing called the electron transport chain. I'm not going to bore you with all that, but at the very end of the electron transport chain, you need oxygen, and that creates ATP, or creates energy. So when you're adding a bunch more oxygen into our system, you're essentially allowing your mitochondria to work a lot more, because your mitochondria want to do stuff. So as you inhale more oxygen, it gives you more energy. It helps with healing injuries, right? You need oxygen for that. Decreases inflammation, increases a lot of antioxidant function. So all that are super beneficial to make you feel better, to increase your energy, to help heal tissue. So hyperbaric therapy is really great for that. So this is my little soft chamber. The different kinds, like a hard chamber is that you see in the hospitals, are more for wound care, more for really serious conditions like crush injuries, gas gangrene. Not something that I would see in clinic. I hope. I don't really want to see that. So soft chamber is still really useful to help with any kind of sports injuries, recovery, headaches, migraines, any kind of inflammatory disease, honestly. So we can kind of explore all of this here, and I have oxygen concentrated in the back. So I'm gonna start. Should I just start going? Explain. Okay, so in the soft chamber, even the ambient air is still fine, but I'm adding oxygen into the system, and I have a little mask here to do that. So this is a little cool thing, so you can inhale more oxygen in this place. So and you kind of feel it in here too. And I don't have a patient, but I can kind of show you how the whole process works. So here I would have the patient go in, and they're going in and sit, and typically sessions around 60 to 90 minutes. So you can bring a book to read, you can take a nap in here, it's very comfortable. So they would lay in there with the mask. I have a pillow there for them. So first I'm gonna buckle this together, and then we're gonna zip the inside. So you need to get this whole chamber pressurized correctly. So this has to be sealed. This chamber has a inside and outside zipper. So make sure that's closed all the way. So make sure this is closed, and then now I'm gonna turn on the air. So the fun part. So this part where it's gonna start to inflate. And with the patient, when you're going under pressure, you have to actually equalize your ear. So doing the Valsalva maneuver, making ears pop. Because when you think about when you're adding pressure into the system, your eardrum, right, it's gonna actually push into your eardrum. So you need to be able to push back to what's called equalizing your ears, or else it's gonna kind of hurt. It's gonna feel uncomfortable. So this goes to about, if you come over here, about like 1.3 ATA, atmospheric pressure, or about 4 PSI. So you can kind of see how it's slowly inflating. So this goes to about 1.3 ATA, which is pretty normal for the soft chamber. So, right now I'll be checking the patient's doing well and they're feeling good. They're not getting too much discomfort in the ear. And then once it goes to pressure, you can kind of hear the valve. So it's going to try to balance the pressure. And this is where you have to kind of check, make sure patient's feeling comfortable. So the going under pressure is what takes the longest. And then once they're under pressure, it's almost like you're just sitting, in a regular room too. So it's very comfortable. Again, you can just like read a book, take a nap, and the patient would be here for around like 60 minutes to 90 minutes. And then soon you'll kind of hear, once it gets to pressure, the chamber will start to equalize too, and you hear like venting. So it's getting there. So right now it's still around 2 PSI, so it's still going. We're trying to get past this blue area right here, so that's when you know that they'll be under pressure. So again, this can be used for any kind of sports recovery, for any acute injuries, especially for, if you have a head injury, it's super important to get treatment right away. Of course, go to the hospital, but also the hyperbaric chamber can help with that too, right? Because its lack of blood flow to the brain can cause damage. So the brain is a tough spot to get oxygen into, right? Because of the blood-brain barrier, it's like not a lot of space. So hyperbaric is the only ways to kind of get that oxygen into the brain to help heal it. So yeah, right now you can kind of hear a little bit of the venting. So almost at 4 PSI. So this is just the valve to, if let's say the patient was feeling uncomfortable in their ears, so you can control this, like how much to vent out, so then it goes slower so that their ears can kind of equalize. So there's ways to kind of customize and make sure that they're feeling comfortable going under. But it's kind of loud, so you can kind of do that. But right now it's keeping it closed. So almost at 4 PSI now. And then when it gets to 4, it's gonna start to vent on the ends of the chamber a bit. And actually, this is one of those chambers you can do it by yourself, but didn't want to do that to just talk in the chamber. That'd be kind of weird. But next time I'll kind of show with someone in it. So now you're kind of hearing the venting. So this helps keep the pressure at a safe depth. So it's gonna do this the whole time, and when you're in the chamber, you won't hear it as much. But yeah, so that's basically kind of how it works. And they would just sit, and the patient inside just feels, like they're breathing normal air. So kind of the basis of how this works. And then when it's done, I would basically bring them back up, right? So you're adding pressure into the system. It's basically based off of dive medicine. So bringing him back up is actually much easier. You would just feel your ears popping a lot, and it's not too uncomfortable. You would try to go slow coming back up, essentially. But yeah, so this is kind of how the hyperbaric works. It's really easy and really comfortable.